Now, with South Africa's recovery rate from COVID-19 improving to 73%, as we have just seen, what happens to those who have recovered? What sort of protocols should they be following? Professor Mosa Moshabela, Dean and Head of School for the School of Nursing and Public Health at UKZN, joins me now to unpack that now. Professor Moshabela, thank you so much for your time. What are the guidelines for recovered COVID-19 persons? In other words, once a person is recovered and rejoins society, how should they behave in terms of hygiene practices, etc.?
Thank you. Greetings, Nati, and to your viewers. It's an important question you are asking. My view is that patients who have recovered, in a way, they can easily fall off the radar and fall off the system. But it's important to understand that they may have sequelae that would last beyond their recovery. So, for example, they may have persisting symptoms, they may have discomforts physically, and also they may have some sort of symptoms that are related to mental health and well-being. So in some ways, it's important that to make sure that those aspects are taken care of, and for them to be taken care of, they need to remain in contact with the health system. Beyond that, I think that it's important to also recognize that even though people have recovered, they may not immediately suffer from reinfection with COVID-19. However, they may still be carriers for COVID-19. They can easily pass COVID-19 from one person to the next. So it's important that they maintain the precautions of hygiene to make sure that they don't pass that infection. And for me, I think that those two areas are the areas that when we talk about recovery from COVID-19, we kind of have to focus on.
Now, a lot of the times people actually, thank you for that answer. A lot of the times people don't know where to turn, to seek clarity because we've been seeing so much misinformation out there. Can people who have recovered from COVID-19 still transmit the virus, whether via their hands or clothing, to other people?
Yeah, absolutely. And I think that that's more of what I mean when I say that they can still be carriers. At the moment, we are not so concerned about them transmitting the infection from their own infection, because then once they've recovered, there is evidence enough to suggest that they may not be infectious. And some of them, even though they may continue to shed some virus, we are convinced enough at this point that they may not necessarily transmit from their own infection. However, it's important to recognize that they can touch a surface where there is active virus, and they can touch someone's hand, and they can transmit it that way. And that, for us, I think it's important. We don't know yet in terms of whether they can be reinfected and whether that's going to play an important role or not. At the moment, that is not our primary concern. Our primary concern is in terms of making sure that they don't transmit through surfaces and so forth.
Now, it would appear that a lot of people, I don't know if it's probably fatigue of lockdown, but they're not prescribing what was initially said that we should do, washing our hands, keeping social distancing, wearing masks. Is there a risk that recovered people could become apathetic in practicing safety, like wearing masks or washing hands or even social distancing?
Yeah, Nati, I would avoid a sort of blaming approach towards the people who have recovered from COVID-19. I think that we need a more compassionate approach towards them. One of the things that I'm concerned about is the fact that they may suffer sort of mental health consequences of having gone through COVID-19, depending on the severity of it. And the sort of the idea of a near-death experience and so forth. Those things are important. And so when we see them perhaps acting out in certain ways, our judgment should not first to be that, this person is apathetic. I'm assuming that anyone who has gone through COVID-19 know enough about COVID-19 and how COVID-19 is transmitted. And what's important there is to sensitize everyone, including those who have recovered, to the risk of passing infection to other people. And though they might not necessarily immediately be at risk of reinfection themselves, they can still pass it to those around them. There is still a lot of people, Nanti, that have not been infected with COVID-19, which means that they remain susceptible to infection. And for as long as they remain susceptible to infection, those who have recovered need to sort of extend the compassion as well towards them to make sure that they don't suffer from COVID-19.
Let's turn our focus a little bit on KZN. We know that the Premier has described it as the province being now in the eye of the storm of COVID-19. But there have been some concerns coming from the Minister of Health saying that they're not seeing a lot of people coming to get tested, but that they know that there are infections where they are. And they're concerned that people are not practicing social distancing, washing of their hands and wearing masks. And I know you say that everybody knows, what to do at this point in time, because there's a lot of information that comes to how we infect. But is that a concern that KZN, the communities in KZN still don't have that appreciation of following those three basic rules that we've come to know?
Yeah. So it's a very good question. I mean, I think that we don't necessarily have hard data to suggest that people in KZN are more complacent than in other provinces. I think that, we can speculate a lot around what is happening. What we do know for sure is that when someone is sick and seriously sick, they will approach the healthcare system. And in KZN, we have monitored both new infections as well as admissions to hospitals. And we can see that they are flattening parallel to each other, which to us suggests that even though there may be people who are infected in the community and are not coming forward to test, those numbers could also be declining. And in other instances, it may be that those people are not severely sick enough. We've heard of cases whereby people have died at home and so forth, but I don't necessarily think that that is special to KZN. And just to comment on the general issue of people who may be complacent, I want to say that, behavior change is hard. And we are expecting people to change their behavior so that they can protect themselves and others from COVID-19, and they need to do this long term. We need to invest a lot better in helping people change behavior, not just temporarily because of urgent risk or immediate risk, but do it for a long-term plan in order to make sure that generally people are going to adopt healthier practices. A lot of the things that we prescribe for COVID-19 are not necessarily peculiar to COVID-19. They are principles that are important generally for health and well-being.